Hi, Loyalos. That's Kathy from Left Undone. I just wanted to talk real quick about the health insurance for the United States. Getting a real bad rap right now, and I understand that because people have been denied coverage in their time of need. But as a nurse that works in healthcare in the United States, I just want to give you a few tips about if you do get a denied claim, there's some things you can do. So, being on the heels of the United Healthcare, Brian Thompson's murder, which I am appalled at, and I am sickened by anybody that's giving kudos for that murder. It's just disgusting, in my opinion. Nobody in this country or in anywhere in the world deserves to be gunned down point blank from somebody walking up behind them. I don't care what they do for a living. So let's just talk about healthcare and claims. If you have a provider, a doctor that says you need this, that, and the other thing, you need an MRI, and they submit it to your insurance, and your insurance denies it, and you go, and they go, oh, they denied it, you can't have that, and you go, what, bunch of fuck you freaking assholes, thanks a lot, click, bye, boom, leave it. You're partly to blame right there. You need to advocate for yourself. Every patient everywhere needs to advocate for themselves. Nobody's going to do it for you. Healthcare is such a busy, busy place. We're exhausted, we're tired, we're overscheduled, we're overworked, and we have to go one to the other, and we triage who's in dire need right now. So, if you think that you got denied something, you call your insurance company and you say, why was I denied? And they go, blah, 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 blah. You say, well, can I talk to a supervisor? Can I have a case manager? Do you understand what is going on with my health? Why was this denied? Is there a way for my provider to resubmit? Did he submit something wrong? Is there another way around this? I promise you, a squeaky wheel in this case makes progress. Should I have gotten a specialist first? Should I have done this or that? Or what did my provider submit? Did he submit it under the right diagnosis? And then call your doctor and say, well, I'm not happy that this got denied. What are you going to do about it? Are you going to help me? Are we going to resubmit this? Do they need more blood work? Do they need more tests? Do they need more proof? Do they need more symptoms? What is holding this back? You are part of the team. Ask for a case manager, ask for a social worker, be the squeaky wheel. You are part of the team. You are not just this person sitting over here going, oh, they denied me. They won't let me have this or that. Find out why. Insist that you know. Ask for things in writing. Look at what they submitted. Well, doctor, you submitted that I've been doing this and that for 2 months. What's the criteria? Oh, well, the criteria is you have had to try this first, this physical therapy first, but you didn't try that, so we denied it. Oh, okay. Well, doctor, they said they denied it because we missed this step. We missed the part where I was supposed to do physical therapy before they would and see if it worked or failed before they went to the next step. Come on, people. Like, seriously, I love my left undoners, but I'm seeing people just bag on the healthcare industry and act like your nurses, your doctors, your insurance is supposed to read every part of this and be the entire team. You're part of the team and you need to act like it and you need to get in there. If it's your kid, if it's your mom, if it's your dad, if it's you, squeaky wheel. I'm not kidding. It's so important that you put yourself in the position of being part of the healthcare team. I want a meeting. I want a meeting with my doctor. I want a meeting with the doctor super. I want to look at these records. Why was this submitted this way? You can do it. Let's not just blame the industry because the industry is a hot mess, busy. with a lot of people. Remember, the generation right now that's elderly are the baby boomers, and it's a huge generation of people. And there are people left, right, and center, very, very, very sick and dying. Now, it doesn't mean that what you have going on is any worse. It just means we're tired as healthcare workers and we're overworked and we're doing the best we can. Yeah, there's crappy doctors that don't submit things or just blow it off when it gets rejected. And then there's good doctors who'll be like, oh, wait. This got denied, but I'm going to resubmit because we need to document more. The biggest thing with submitting to your health insurance is the documentation and the steps that prove you did and your doctor did and tried this and did that, and this is what the symptoms are, and this is what the blood work shows, and this is what's happening. I know I'm talking in generalities, but you understand what I'm saying. Do it. Be the squeaky wheel. Something gets denied, don't throw it in the trash and be like, what a bunch of assholes. Become part of the team, because you are. You're probably the most important part of the team. So anyway, that's what I wanted to say, because I'm seeing stuff out there and, people being happy about this and also not realizing that you are part of the healthcare team and you need to do your part to get what you need.
Well, that's the thing. Is it getting worse? And speaking of being clear, I want to be clear. Nobody's justifying violence, the killing of someone in cold blood in the New York City street, but it is highlighting these issues, to your point. What about it is getting worse?
Well, ultimately, here's the bottom line is when we as physicians order certain tests, whether it's for a patient going through chemotherapy or even something as simple as a mammogram, we're getting what's called a denial. This patient cannot get the mammogram unless you do something called a prior authorization.
Right.
And a prior authorization basically simply means giving the insurance company the ability to get back in the driver's seat and decide if they are going to pay for a procedure or not.
When you started, though, was that happening less? In other words, that's happening more now?
I think it's happening more now. I mean, I'm in my 20th year of practicing as a primary care physician, and I can remember way back when I was a resident how this was an issue. But now, we sometimes wonder as physicians, is it artificial intelligence that's the doctor, or is it people like us that are trying to advocate for our patients?
Well,
to get what you need for your own lives. It's important, right? All right, everybody. Nice to see you. Stay safe and so well. I will be back soon. Bye.